Hello, this video is to show you the skill of intramuscular injections. To begin with, we always want to verify our physician's orders, and we want to ensure that we have the correct medication and provide the 7 rights of medication before any medication administration. Secondly, we always identify our patient with 2 identifiers. We always introduce ourselves and be prepared to ask any questions about the medication that we are giving. Ensure your patient's comfortable, and then we can begin. First, you want to get your medication, of course, from the medication room. We want to verify that at least 3 different times prior to giving the medication. Ensure that the patient has no allergies or any reactions in the past to any medication that you are going to be giving. Once you get your medication drawn up, you will be prepared to go ahead and enter the room and give your medication. So I'm going to go ahead and get that prepared. For IM injections, we want to use a 2 to 3 ml syringe, and we also want to do a 22 to 25 gauge needle. When drawing up your medication, you always want to use an 18 gauge needle just to draw that up, and that just gives you the best, easier way to pull your medication up. If you're using an ampule to get medication from, you'll break that and always use a filter needle to remove that medication prior to giving that injection. And then we change those needles prior to giving. So we'll cleanse our medication once we've verified that again. And we're going to draw up our prescribed amount. We'll put the air in our syringe. In this case, we're going to do 1 milliliter. We're going to inject that into our medication once we've cleansed that with our alcohol. And then we'll turn that upward and we'll draw up our amount of medication. We want to ensure that there are no bubbles in the syringe. If we do have bubbles, we can lightly flick that to get those bubbles out. Once we have our prescribed amount with no air bubbles, we can withdraw our needle. And then we'll want to discard this needle and replace it with our ordered needle. And in this case, we're going to go ahead and use a 22 gauge. We want to maintain an aseptic technique when changing needles and withdrawing medication. So once we have that ready, we have our medication. We're going to label that with the patient's name, the date, and the medication that is in this syringe. And we'll take that and all of our other needed supplies to the patient's room. We'll explain the procedure and give the patient time to ask questions and answer any questions they may have about the medication they are going to receive. For your IM injections, we have 3 different sites that we can use. First, I'm going to show you the Ventrogluteal site. This site is located near your hip area. Here you can see, and we're just going to palpate that area just to check and see the muscle area. And to do that, you can also do your V on a patient's hip, and that gives you where your location would be. We always clean the area after we've explained the procedure with an alcohol wipe. We're going to cleanse in a circular motion from center to outer in a large area around our insertion site. We'll take our injection needle, and for this purpose, I'm going to use I'm not going to actually inject it, I'm just going to show you how we would do that. So in this instance, we're going to say your patient has an order for the Z-track method. For the Z-track method, you will take your hand and displace the skin. You've got your area cleaned. You'll remove the tip of your needle, and we have the skin pulled over, and we're going to insert our needle at a 45 to 90 degree angle. We'll ensure we're in the proper area and slowly inject that medication. Once you have that injected, you're going to slowly remove the needle as you're slowly returning the skin to its correct position. And we're going to wipe off any excess and place on a Band-Aid or cover as needed in that area. Ensure our patient is comfortable and doesn't have any needs that need to be taken care of prior to giving any other medication or whatever the order may be. Our other areas for injection include our vastus lateralis. And we're going to turn our patient here to show you that muscle. Another site for IM injections is your vastus lateralis. Again, you want to check that. That is on the outer aspect of a patient's upper leg. And you can feel that large muscle. So again, you'll want to find your muscle, cleanse your area with your alcohol pad. After you've done all of your 7 medication rites and you have your medication prepared and scanned and ready to give, you can cleanse your area with your alcohol. You have washed your hands, you have your clean gloves on, and you would want to inject that at a 90-degree angle. You want to hold it as a dart and directly into the patient's skin. Once you've informed them that you're about to do that, you will slowly inject your medication and withdraw your needle, place on a Band-Aid or gauze as needed for that patient, and you are good to go on that one. Our last site for IM injection is your deltoid area, which is about 2 fingers below your shoulder. So when you find that muscle, which I can show you here, in this area, you can feel that muscle. In this area, you only want to give no more than 2 mLs. And we'll use the same syringes, your 3 ml syringe with your 1 ml of medication. We'll cleanse the area just as we did all the rest. We'll do a 90-degree angle and remove, and that is all the same. We always want to ensure that our patient's comfortable and that their needs are met, and document the medication once it is given. We always want to monitor the site, injection site, to ensure that there's no issues after that has been given as well. And that is all for IM injections.